This is Altura Now with Steve Eiliff.
Thanks for joining us. Information about the COVID-19 crisis is evolving every day, and joining me to discuss the situation in home and community care is Joseph Musgrave, Chief Executive at Home and Community Care Ireland. Joseph, thanks for joining us.
Thanks, Steve. Good to be with you.
Joseph, can you give us an overview of the current situation in Ireland with regards to COVID-19 and social care?
Sure. So, in Ireland, we have, I think approaching our 9,000 infections across the country at time of recording this interview with you. And the pressures are, one, of the ICU sector. We're seeing a number of hospitals begin to reach ICU capacity, but also seeing the first wave of people now being discharged from hospital. So it looks like at the moment, the situation in the acute sector is, while still stressful, is relatively under control. The situation is a bit more complex in social and community care. Nursing homes and residential care facilities in Ireland seem to be the main place where the infection is spreading. I think over 120 nursing homes across Ireland, there's around 430 in the country, currently have an outbreak of coronavirus. And one of the big issues the nursing home sector face, which is not HCCI's area, but is of our sister company, sister organisation, Nursing Homes Ireland. You're seeing not only the infection spreading in nursing homes, but also quite severe staff shortages. In community care and care at the home, which is what HCCI represents, we're seeing very low rates of infection. I think at the moment it's less than 0.5% of infections across the country, across the 20,000 clients our members care for. Of those, in terms of absolute numbers of that 20,000, around 30 currently have the infection. The majority of those are being cared for in hospital, and we have around 5 or 6 cases now of people who are COVID-19 positive being cared for in their own home. The biggest stress factor we faced, in addition to, I think, everyone else's stress factors of adapting to this new reality, has been the number of clients. Around 25% of care hours nationally have been cancelled voluntarily. It's actually maybe close to 30% now. Clients who decided that they didn't want to take the risk of someone coming into their own home, so they cancelled their care. So one of the big problems we faced with dealing with that is care staff are remunerated for the work they do. And if they can't go into someone's home and provide the care that they love to do and they're trained to do, it's created a big problem. So in March, the sector had to pump in around €1 million to keep staff on payroll because there was no income coming in from those cancelled hours. And we've wanted to keep the care staff and the care sector ready, willing and able with capacity in order to meet the changing nature of this virus. We've now reached understanding with the health service here, the HSE, to support those care workers through April and the beginning of May, to keep them sort of on call for Ireland, on call to respond to the virus.
I guess amongst people in care, there needs to be some sort of confidence that they are protected. So let's talk about frontline protection issues. There's a raft of measures that apply to slow the spread of the virus. Can you run us through some of these and how is the sector responding?
So in the first instance, the public health advice in Ireland is that for the normal service, if you like, where there's no suspected case of COVID-19 or confirmed case, the normal precautions apply, in addition to some of the messages we've received on social distancing and hand washing. So, for example, most home care services in Ireland, they will generally, it's gloves and aprons that are worn, like a standard apron and standard gloves. The public health advice is to just continue with that, but also to ensure hand hygiene is adhered to, washing of hands frequently upon entering the house, upon exiting, and also upon sort of major sort of interactions, depending on what that is, whether it's helping people with toileting, etc. And also maintaining, where possible, some measure of social distance when in the home. That's also not always possible, but that's the sort of general landscape of the advice. Once you enter into the realm of a suspected or confirmed case of COVID-19, that's where you enter the need to wear enhanced PPE. And Ireland's big challenge has been the very nature of that PPE. Initially, Ireland's used to a certain type of PPE, which I think the West is familiar with, in terms of a mask that's tied around here and looped at the top of the head, goggles, etc. But an order was received from China and still comes in, and this is more face shields and hazmat suits. So that PPE is being centrally rationed by government and issued where necessary to deal with COVID-19 suspected or positive cases. It is being rolled out to staff who work for HCCI members on that basis. One of the biggest challenges has been to mark out the territory that is sort of like the normal service, where the enhanced PPE doesn't apply, and try and reassure people that the enhanced PPE isn't currently necessary in the eyes of the public health authorities. And then where enhanced PPE is needed, the biggest challenge there has been to train people initially to use it. It's not something that's standard in the home care service here in Ireland, but then a second raft of training needed because some of that equipment is changing because of the sourcing issues that are worldwide, and you've got to pull in this PPE from where you can get it, and sometimes that means it's not the standard stuff that the training videos provide for.
Now, every country around the world is experiencing logistic and supply chain issues. What are the steps being taken to ensure the constant supply of PPE, but for other items as well, not just PPE, but other items?
Yeah, so, well, if we talk about the enhanced PPE for a second, the face masks, the gloves, the suits, Ireland has been using every single resource it can, including deploying Bono to phone lines to open up PPE supplies. So Ireland's got a good bit creative to try and use soft power to open up connections it wouldn't ordinarily have, and has been quite reasonably successful in sourcing PPE, most notably from China, on the enhanced PPE. And as I said, it's being centrally rationed here in Ireland, and provided free to providers as needed. So whilst it's definitely a problem in the nursing and residential care setting, in the home care setting, I don't have large reports or concerns right now about the availability of enhanced PPE. Where there is a problem, Steve, is in the normal PPE, the gloves and aprons I talked about as part of the normal service, and so some sterilizing gels and that sort of thing. We're seeing the cost of that increase. We're seeing the availability of that decrease. And members of HCCI have been engaged in quite detailed discussions with their local suppliers. And thankfully, they're being relatively understanding and doing their best. It's a problem that at the moment, it's an issue rather than a problem right now that I'm keeping a close eye on. We may need industry or even government intervention if the issue escalates into one where we're getting widespread scarcity. Right now it's under control, and suppliers are working hard to make sure that both the normal PPE is available and that it's done at a reasonable price, but it is something I'm keeping a close eye on.
Joseph, this is a difficult time for everyone. What are the mental health considerations we need to make as a community for staff working in home and community care and those receiving care?
So the government here in Ireland has launched a mental health campaign to try and keep people connected, and there's resources on gov.ie in that regard. I think once we home in on home and community care, there's a couple things which are important. I think the first is, as much as we can, clear and regular communication. In terms of anxiety with dealing with caring for people, it's very important that carers have the most up-to-date advice and clear communication from the companies. I think is very important. I think I said earlier, we've had around 25-30% of virus nationally cancelled, and a lot of clients are fearful of contracting the virus incidentally. And so we have to, again, try as much as we can to keep, even though companies aren't going into these people's homes, getting on the phone, other means of communication, whether it's video calling or whatever, is important to try and keep the link between the care they want to see resumed and also making sure they understand in what situations is enhanced PPE relevant, in what situations is the normal PPE relevant. How do they resume their care if they want to. And we're starting now, we're several weeks in now, we're starting to see people who cancelled their care sort of in mid-March now looking to resume it because they don't feel they can wait any longer. So really there's an anxiety question which is around communication. I know several companies are looking at different mental health initiatives to help people stay fit and active when they're not working and make sure they have the resources needed to access, I think things like, counselling services are important in this time to sort of be a support to those carers. Clients, it's hard, if they've got family nearby, I think that will help them get through this time and to talk and to connect with them. I really do fear for people who are alone. We are seeing a great community response from people. The On Post, the postal service here is helping provide some sort of continuity with things like newspaper deliveries for free and that sort of thing. So all of these little things, it's not one big initiative. It's essentially society coming together. And we talk about cocooning in terms of staying away from the virus, but I think it's sort of cocooning in terms of society looking after itself and looking after one another, being there for one another.
And the workforce is a big issue. I've noticed you've agreed to the HSE's request to redeploy some home carers to support other frontline healthcare workers. Can you tell us a bit about this?
In late March, the 1st of April, so 31st of March, 1st of April, the HSE contacted me and said that they were willing to offer more comprehensive support to the sector to cover the cancelled calls. But in return, they wanted staff to be available to be redeployed into what was, in the 1st of April, emerging as a major problem, which was staffing shortages in particularly nursing homes and residential care facilities. And I made the point to the HSE that we can't compel staff to volunteer, and we should not make payment for cancelled calls contingent upon redeployments. I think the argument I made is that we need to retain capacity in the home care sector as a whole to respond to complications arising from COVID-19 if someone contracts it. From people in the ordinary run of life, they need home care because of whatever situation. That doesn't suddenly stop because of a pandemic. And in fact, it tends to be hidden because of a pandemic. So I said we need to retain capacity, and the HSE seemed to agree in principle with me. At the moment, we're not seeing great numbers of staff being redeployed. I think it's probably in maybe 300-400 hours of nursing home shifts have been covered by home care staff because we haven't received any of the documentation until Friday around how that was going to be governed. And although we have around over 500 carers who say they're willing to be redeployed to a nursing home, that can't happen in a programmatic way. And it's taken a while for the HSE to communicate to us how they want this to work. And as I said, we only received on Friday the documentation from the HSE outlining how this might work, which is currently being reviewed.
I mean, it's a sector that has that struggles in a lot of countries. What are your thoughts on the future stability of the sector?
I think we're at a very important inflection point with the future of the sector. There's an interesting paradox in that governments around the world have been saying that home is the safest place for you to be, which is why they've instituted lockdown measures. At the same time, the very last part of the healthcare service most countries have looked at is the home care service. It's the community that is going to be managing this virus most effectively and for the longest period of time. We are going to have a continuous situation until we have a vaccine where some categories of people will probably need to stay mostly at home until it's safe for them to emerge from home. We will also have situations where, given how contagious COVID-19 is, when some people contract COVID-19 a few months from now, the safest place to keep them may be indeed their own home, because if we transfer them to hospital, there's very real danger of secondary transmission. So governments around the world need to smarten up here, and they need to change their focus purely from thinking of the acute sector to how do we support the home. Acknowledge the crucial place of the home care service in our healthcare landscape. It can no longer just come as an afterthought after the acute system, after the residential system, and then sort of whatever is left in terms of resources and mental capacity to think about, we'll get to the home care service. We need to turn that on its head, because it's the home and it's the community where we're asking the brunt of people to bear out COVID-19.
I mean, you're doing a lot of communication with the government, a lot of lobbying for the sector, to try to get more support. But what else are you doing? What are you doing for your membership during this crisis? What information are you providing? What are you doing for them?
Yeah, well, we have a newsletter that goes out, every second day, pretty much, with the latest updates, the latest resources, the latest information from us here at HCCI. Part of those newsletters cover just the general resources. Part of them, the latest pay policy, or even calls to action to make sure we're getting the message to all the politicians we need to. So the newsletter is a sort of central pillar of our communications. We have a weekly call with the members where I get on the phone and I'm available to answer any questions they have. And I think that's a good outlet for many providers to plug in, and we're seeing the attendance of that is really high. And I think the members value that ability and that open and honest forum. And I don't always have, in many cases, I don't have the answers, but the fact I'm available to them, I think, helps an awful lot. And we have collaborated with a couple training providers, not least Altura, over this with COVID materials to provide risk management solutions and additional training, so that providers can get their head around how they help to manage COVID-19, how they communicate with their staff and their clients.
And so, what's the best advice you have for the sector as we all work together to fight this threat and move towards recovery?
Yeah, it's. I think number one is keep getting on with the day job. You're doing an excellent job. You're doing excellent work, and I think throughout the world we're seeing that the home care service has quite low rates of COVID-19 infection and quite low community transmission. So I think we need to concentrate on the day job is number one, and look after your clients, look after your staff, and follow the latest public health advice, keep up to date with it, but question it too. We have seen it change and evolve, so by all means, I think we should be questioning that advice and sometimes adopting measures quicker if we need to. And the most difficult thing of all is to be patient. If you have trust in people representing you as a home care provider, I ask you to extend that trust a little bit longer. Be patient. We are working through these things, and we need to stick together.
Great advice, and it sounds like you're doing some fantastic work. Joseph, thanks for joining us. We hope to see you again soon.
Thanks, Steve. Pleasure to be with you.
And please get your information from trusted sources and stay safe. I'm Steve Iliff. Join us next time on Altura Now.